Good afternoon, everyone. Thank you so much for being here this afternoon. And in particular, I have to say it's great to be joined by colleagues from dozens of national governments, civil society groups, and the private sector. This group, in all its diversity, demonstrates a fundamental truth about the synthetic drug crisis. No part of the world is immune. To effectively protect our people, we need to work together across governments, across regions, across sectors. You just had a brief glimpse at the video a moment ago, and I think it's very powerful, even in those few short minutes, the profound threat that synthetic drugs pose as an urgent public health threat to our people. Here in the United States, synthetic drugs are the #1 killer of Americans aged 18 to 49. We had nearly 110,000 overdose deaths last year in the United States. More than 2/3 of those had a synthetic opioid like fentanyl involved in the death. This crisis has an immeasurable cost. It has devastated families. It's devastated communities. It's also been overwhelming to our public health and criminal justice systems. But here is the reality. The United States may have been, to some extent, a canary in the coal mine when it comes to fentanyl, but alas, we are not alone. Criminal organizations trafficking drugs are exploiting gaps in our interconnected system to bring new drugs to new places in new ways. And every region across the globe is experiencing an alarming rise in synthetic drugs, from tramadol in Africa to fake Captagon pills in the Middle East to ketamine and methamphetamines in Asia. In Australia last year, law enforcement seized 5 million doses of fentanyl, each one potentially lethal and reflecting the largest shipment authorities had ever seen. In the European Union, 41 never-seen-before synthetic substances were reported just last year. As the UN Office on Drugs and Crime has found, the synthetic drug trade in Asia has now reached, and I quote, extreme levels. We launched the Global Coalition to address synthetic drug threats in recognition of the scale of this challenge and of the need for strong, coordinated international action. In July, we convened the first ministerial, joined by officials from more than 80 other countries and leaders from over a dozen regional and international organizations. This month, the 3 working groups that we launched focused on preventing the illicit manufacture and trafficking of synthetic drugs and their chemical precursors, detecting emerging drug threats, and promoting public health solutions. These working groups held their first meetings. Now, we have brought together representatives from over 100 countries, from every region in the world, as well as civil society and the private sector, to channel the experience and expertise of the broader global community into concrete and effective solutions. Public health solutions, as we're seeing in Kazakhstan, which just launched a new 3-year plan that provides record investments to help minors who are suffering from substance use disorders. Law enforcement interventions, like the national coalition set up by Honduras, bringing together the military, the police, prosecutors, the private sector, to improve the regulation of legal precursors coming into the country. Novel solutions that engage experts, including scientists, like the UN's efforts to help build the capacity of more than 300 national forensic laboratories in 96 countries, training scientists, providing technological tools to help them better detect synthetic drugs. These are precisely the kind of interventions that we'll share, we'll replicate, we will bring to scale through this global coalition, while supporting other best practices, like expanded information sharing between governments and the private sector, stronger shipment labeling standards, and know your customer practices to help prevent the diversion of precursors into illicit use. At the same time, we will continue to use every tool in our diplomatic toolkit to tackle this crisis. That's why this year we are providing more than $100 million to help our partners better detect, identify, and interdict drugs, and to provide vital treatment and prevention services. Already, we've supported projects to create a new surveillance system to monitor new narcotic substances through the World Health Organization, to connect people in the criminal justice system in partner countries with effective health treatments like rehabilitation, and to create an online platform for law enforcement around the world to share information about emerging drug threats. And to build on our diplomatic efforts, we are taking 3 additional steps, each with the goal of translating initiative into action. First, the United States will name an envoy to elevate our diplomacy on this issue, working with countries around the world to confront this global threat. Second, later this year in December, the United States will introduce a resolution at the United Nations General Assembly highlighting the global health and security threat of synthetic drugs and urging international action to address them. We're already working with our partners to help build consensus for the text. We welcome all countries joining as co-sponsors. And third, the United States, alongside of UNODC, will be partnering with tech companies in the fight against illicit drugs. Among other things, we'll be focused on finding ways to deny criminals access to online platforms to market dangerous drugs, as well as developing tools to help those seeking treatment options for substance use disorders. Now, several of you in this audience are already partnering with us, and we look forward to more joining the effort. So as you can see, we are laser focused on taking concrete steps so that we can help save lives. The lives not just of Americans, but of people around the world. There is no issue that is more obviously one that requires, that demands, that urgently needs international cooperation than this one. But I'm convinced that if we work together and if we act together, we can make a profound difference in literally saving lives. So, to everyone here today, thank you, thank you, thank you. Thank you for your work on this crisis. Thank you for your commitment to partnership. Thank you for all that you're doing to save lives. And with that, I'd like to invite my fellow panelists to come up and join us on the stage. Thanks for being here.
Okay. So let us start this panel by thanking you, Secretary Blinken. I'm very, very grateful to you and to your team for organizing today's event and for your efforts to promote international cooperation on synthetic drugs. And I would also like to welcome all of you who have joined us today, and of course the very distinguished panel, which I'd be very honored to moderate. You have heard Secretary Blinken say it. This is going to be a battle that we all have to work on together. The impact of synthetic drugs on people and society is devastating. And we have seen it in the movie, in the film there. It's tragic to see lives destroyed, to see women suffer while facing systemic barriers, and to even see young children lose their lives and their futures. There are many harrowing stories behind the numbers. As Secretary Blinken has said, synthetic drugs have become the #1 killer of people aged 18 to 49 in the US, mostly due to synthetic opioids such as fentanyl. And the problem is global, extending and expanding across all regions in different deadly forms. Methamphetamine is the most widely produced and used synthetic drug around the world. According to the World Drug Report in 2023, seizures have tripled in just 6 years. That is a pace of growth much faster than cocaine. UNODC just launched a new report on methamphetamine trafficking in Afghanistan and neighboring countries, which is surging even as the heroin market slows down. Meanwhile, Africa continues to grapple with the non-medical use of tramadol. The Middle East is flooded with Captagon pills, and ketamine seizures are hitting record levels in Southeast Asia. The ability to chemically synthesize immensely potent drugs at a low cost has opened doors to huge profits for criminal groups and daunting new threats to security, development, health around the world. To face this transnational threat, we need joint global action based on common understandings and shared commitments. From early warning to investigation and prosecution to prevention and treatment, we need cooperation between countries as well as with civil society and the private sector. The solution lies in multilateralism, and that is where the United Nations comes in. The UN Office on Drugs and Crime has been at the forefront of global cooperation to face the synthetic drug threat, providing research and technical assistance. UNODC's synthetic drug strategy helps countries enhance health responses, early warning, and counter-narcotic interventions, and supports multilateral responses. Our office supports the UN Commission on Narcotic Drugs, the CND, where member states set the international drug policy agenda, and recent sessions of the Commission have placed the issue of synthetic drugs among the very highest priorities for all countries. The global coalition today to address synthetic drugs that is launched by the United States this year can galvanize joint action in support of the CND's commitments and complement ongoing technical work on the international level, including the work of UNODC. And I'm confident that today's discussion will provide important insights from across regions and across sectors on what is needed to step up global action and cooperation against the challenges of synthetic drugs. So it's now my pleasure to introduce the distinguished panel. We have heard Secretary Blinken. I have on my left Ms. Johansson, European Commissioner for Home Affairs. On my right, Ms. Marta Machado, National Secretary of Drug Policy of Brazil, and Sir Nick Clegg, President of Global Affairs at ETA. Welcome to all of you. We will have 2 rounds of questions for the panel, after which we will close the panel discussion and have some interventions from the podium. And with that, I would like to kick off the discussion and start with a question to Ms. Johansson. Ms. Johansson, one key line of effort of the Global Coalition is preventing the illicit manufacture and trafficking of synthetic drugs. What is the EU currently doing on this issue, and how do you think the Coalition can help advance progress in this important area?
Yes, first, I thank very much for the initiative of this coalition. I think it's very, very important, and I think it's important that we see that we can put this issue on the highest political level, because that's absolutely necessary. Just to give those that, the criminal groups that are behind, this is an extremely profitable crime. And they are acting at such a scale. They are very professional, they are very international. There is this huge and powerful network. And it takes a network to fight a network. So that's why it's absolutely necessary that we work together, and that we can also disrupt the money that goes behind these networks. So to answer your question, the situation in the European Union is that synthetic drugs are growing, but our biggest drug is cannabis. The drugs that are growing the fastest is cocaine, really. We seized last year 300 tons of cocaine, and it had 0 impact on the price. That means that we have a lot of supply of cocaine. Third is the synthetic drugs, and they are on the rise, and actually we are producing synthetic drugs in the European Union. We are a producer in the EU. And then, of course, we have heroin, which is the most deadly drug that we have. So we are hearing this canary bird from the US, and that's why we are preparing ourselves. So far, fentanyl is very, very limited in the European Union, only a few countries. We had last year 140 deaths. But of course, we understand that it's probably a question of when, not if. That's why I presented to have a new mandate for a new EU drugs agency with a much better early warning system, with better laboratory capacity, but also double the resources. I think this is absolutely necessary to be aware, to work with them. And what we also hear there from this video, to be prepared. But also to work on the international arena. And just one example, I was the first ever EU commissioner to travel to Latin America. I was in Colombia and Ecuador. Why had this never ever happened before? Because being responsible for home affairs was being at home. But now the criminal groups are acting across the Atlantic. It's absolutely necessary that we also connect to build the network, to fight the networks. And next week, we're going to host in Brussels 14 ministers of interior from Latin American countries to discuss exactly these issues together. So I think this is also part of how we need to tackle this, to do it together as a network. And I think that this coalition is a great opportunity for that.
Thank you. It takes a network to disrupt a network. So I turn now to Ms. Machado. Detecting changing dynamics is essential when it comes to the swiftly evolving synthetic drugs market. And it is one of the areas of focus of this coalition. Can you tell us about the efforts of the government of Brazil on detecting emerging drug threats and use patterns, and how the coalition can support and advance such efforts in Brazil and beyond?
Well, dear colleagues and authorities represented in this table, thank you, Ms. Wali, for the question. It's an honor to represent Brazil in this important event. Brazil's size and federal system comes with many challenges. Besides that, we are emerging from a period of denialism and anti-science political leadership. One big issue we face now is the lack of current data on prevalence and patterns of drug use. Our last national statistical study was produced back in 2015. Nevertheless, we are made aware of crisis situation overwhelming our health system. This was the case with the synthetic cannabinoids in São Paulo earlier this year. We are particularly concerned with the low cost of these drugs in comparison to other drugs. They are even cheaper than crack. And this contributes to the widespread use among youth living in urban peripheries. Police data indicates that seizures of synthetic cannabinoids in São Paulo in 2022 were double the amount of the previous year. And just in the first 4 months of 2023, they had already exceeded the previous year by 30%. In response to this concern, we are building and strengthening the Brazilian Observatory of Information on Drug so that we can publish a prevalence study in early 2024. Regarding opioids, although Brazil is still far from the dramatic prevalence of use and mortality in North America, a recent study published by The Lancet indicates that we registered a 500% increase in the legal sale of this type of substance from 2009 to 2015. The situation has most likely deteriorated through the COVID-19 pandemic, yet we are unable to estimate the consequences of increased opioids prescription through that period. We are concerned with the evolution of illicit drug routes and have just concluded an important study about trafficking routes crossing the Brazilian Amazon. It is one of the priorities of the Brazilian Ministry of Justice to strengthen public security in those territories. We are learning that there are constant changes in the drug routes through the Americas, which follow market shifts and shifts in regulations. And this may increase the need to monitor off-mark fentanyl crossing borders. Illicit markets of opioid appeared absent in Brazil up until 2 recent seizures of fentanyl were reported this year. One in particular involved the cooperation with the FBI and found online sale on the deep web. Another emerging concern is the potential mixture of fentanyl and cocaine. One of our responses has been to strengthen our early warning system alongside the creation of Brazil's first internationally certified laboratory for drug detection. But Brazil is so huge that our goal that we need to establish one of these in each of Brazil's 5 regions. Moreover, we have already launched a plan to modernize drug detection equipment in our 27 federal states, and we are building the capacity of forensic technicians. While we are advancing in this process, it's important to rely on this space for international cooperation, which can bolster our interventions by bringing different expertise and technologies to our attention. We learned with the COVID pandemic that public health emergencies should be tackled in global cooperation, and we see the synthetic drug crisis as a challenge which similarly crosses borders and require transnational efforts.
Thank you, Secretary Machado. Thank you very much. As you have said, it's not if, it's when. Lots of capacity building is needed and lots of information sharing and collaboration. Let me turn now to Sir Nick to discuss the key issue of prevention. And it's a pleasure to have the private sector because the private sector has an important role to play. So promoting public health interventions and prevention services is another key line of effort for the coalition. And it's one of the needs and it's one that needs to involve different actors and stakeholders. What is Meta doing to help promote prevention and public health? And how can the coalition and the international community work with you to advance these goals?
Well, first, can I just say, like I'm sure everybody here, my heart really goes out to all those people who have been affected by this unprecedented increase in deaths from the overdose and the use of these synthetic drugs. The victims who've lost their lives, their families, this community. I mean, this is just ripping through families and communities. It really is. It really is heart-wrenching. And I say this not just on behalf of the tech company that I work for. I also just say it as someone who's had a long-standing interest in drugs policy or drugs policy reform. I'm a member of the Global Commission on Drugs Policy, which was formed by some Latin American presidents some years ago, President Cardoso from Brazil, Zedillo from Mexico, Gaviria from Colombia, Kofi Annan, before his untimely death, was a very active member. And I have to say, I think so much of what Secretary Blinken said really, really resonates with me. The world has been declaring a war on drugs repeatedly for the last, I don't know how many, several decades. It's never quite succeeded. Dealing with this for what it is, which is an absolute health crisis, making sure that users are given the support and the help that they need, making sure that law enforcement goes after organised criminality rather than over-criminalising users. I think all of these things are reflected in that excellent video, as was that fantastic project in Denver, which is exactly the kind of thing we need to see more of. And I really would urge the coalition to continue to look at the evidence and the data of what works rather than what sounds good to try and deal with this. As far as Meta is concerned, I mean, we're a social media platform. Billions of people use our products and services to communicate with each other, express themselves, reach out to others. And I mean, our sort of North Star in all of this is to work, as we have done for many years, with the experts who really understand all the intricacies of as you said, the changing market, changing regulation, changing user habits, changing chemistry, and also the NGOs who are active in this area. As the final slide in that excellent video suggested, no one can deal with this on their own. It can only be done together, multilaterally, across the private sector, public sector, across different jurisdictions. And if I can just give you a couple of examples to illustrate the point of this sort of partnership working, Meta joined the Ad Council on a major campaign to equip parents and caregivers to have open and candid conversations with their teens about fentanyl. We joined forces with the Centre for Safe Internet Pharmacies to promote the efforts of the DEA National Prescription Drug Take-Back Day, but also internationally. We in the UK, we're actually just about to launch an awareness-raising campaign called With You, which promotes stories and reels and posts that highlight for youngsters how they can report on Instagram anonymously if they come across drug content, so that they know what to do about it. And a lot of these NGOs, of course, use these social media platforms to amplify their own message, raise money. I was looking the other day at a very important organisation called Facing Addiction. When they launched their Voices project campaign on Facebook, they increased their online donations by over 30 times during the course of 1 year. And of course, many people just use social media to create groups where they can communicate with others who might help them understand what's happening to them, their communities, or their children. And that is something that we continue to try and support in cooperation and in partnership with the experts, with the non-governmental organisations who do such excellent work in this area.
Thank you very much. So the power of social media, science, experts, civil society, and going after the traffickers, not the users, right? I will now turn to Secretary Blinken. You have mentioned some big plans ahead of the coalition. Can you tell us what more is in store and how government, private sector, and civil society partners can get involved?
Thank you. The most important thing we can do is be very practically minded and practically focused. And so we have these big meetings, including this week in New York. We bring a lot of people together. But as I like to say, what's really important is not the one day you meet, it's the 364 days that follow in terms of what you do. And so for this coalition, we've been very focused on bringing this down to very concrete, focused working groups. And so out of the initial coalition meeting, we developed three broad working groups. First, to look at what we can do to more effectively stop the illegal manufacture or illegal trafficking of synthetic opioids or their precursors. Second, a group to focus on emerging uses and use patterns to make sure that, to the best of our ability, we see in real time something that is popping up before it's too late. And third, to really focus on prevention, on treatment, on remediation, because fundamentally for so many of us, this is really a public health challenge.
Yes.
And we want to make sure that across the board our public health systems are functioning effectively. And the idea of these working groups is to bring tremendous expertise together across countries, across sectors, because it's critical that we engage the private sector if we're dealing, for example, with the illegal diversion of chemical precursors. Well, we want to make sure that we're getting with the chemical manufacturers, the shipping companies. If we're looking at the online trade of these drugs, we want to be working with the platforms. So all of that is coming together. We now have, as a result of this initial coalition meeting, and a meeting we had just this past week of the working groups, we now have 107 countries, organizations, and 900 people come together to start the work of these groups. There are going to be subgroups that focus in on very specific issues, looking at best practices, looking at what each of us has learned. I'm convinced, I think most of you are as well, who've been engaged in these issues for years, that somewhere in the world on any given problem, someone has found the solution. The challenge is sharing that information. So a big part of the power of this coalition is to make sure that we are sharing good ideas, best practices. And then we'll probably put them to work. And Agata, something you said is really important. This effort is supportive of and complementary to the incredible work that the UN is doing and ODC has been doing, and various other initiatives. And we want to feed our efforts, our results, into this work. We hope to have a resolution that brings together as many countries as possible to raise awareness of this issue. And then to the very important meetings that are happening next year, we'll be feeding all of this in. This coalition is, in a sense, a time-limited enterprise. By the end of 2024, we want to have achieved very concrete results, concrete policies, practices, ideas that hopefully can be shared. And the last thing I'll say is this. There's a difference between plant-based drugs and these synthetic drugs. Yes. And it goes to this. The plant-based drugs generally take a pretty large-scale enterprise in order to cultivate the crops, bring them to market, etc. We know that when it comes to a synthetic opioid, a room the size of the platform we're on is big enough to produce tens of thousands, hundreds of thousands of pills this size that can easily be shipped over borders, into communities, into homes. I have to tell you that as the parent of young children, I'm terrified at the prospect that they will encounter what seems to be an innocent little pill, and that in its small size has death written all over it. If you read the papers today here in New York, there's just an incident that seems to be involving synthetic opioids at a daycare facility where small children, aged 2 and 3 years old, somehow came into contact with synthetic opioid. One of them died, the others are in serious condition. This is the day in, day out story in the United States. And we have to be able to do both things at the same time. We have to be able to deal with the ongoing problems of things like cocaine. But I just want to tell you, because we've lived it, we're experiencing it here in this country, this is coming. Yes. This is coming. And the more we can work together to help deal with the problem that all of us have, but the problem that is coming to many others, the better off we'll be. And my hope is that the very practically focused work of this coalition will help us get some results.
Thank you, Secretary Blinken. Practical, pragmatic, and focused work is what we need. Let me now turn to Commissioner Johansson and ask a quick question. Multilateral fora, like the UN Commission on Narcotic Drugs, the CND, and global initiatives such as this coalition provide the unique opportunity to exchange best practices and lessons learned with other governments and non-governmental partners. Can you highlight for us a few key lessons learned that the EU and its member states can share with partners to improve the responses to the synthetic drugs threats?
Yes, I'm happy to do that. I think what we are doing in the EU that we are pretty good at is that we have had for 25 years now this early warning system. We have now new powers in it and that are monitoring more than 900 different drugs. I think this is a good thing. We have a best practice portal that is working. We are quite advanced when it comes to treatment, when it comes to harm reduction, when it comes to prevention. We are now focusing especially on women that are less having access to treatment compared to men, for example. But what we need to do better is also on the criminal side in the EU. I should say that what I started to say, that the criminal actors are so big and they're so international, they have so much power, so much money. It's important that we can have also stronger regulation when it comes to seizure and confiscation, when it comes to go after them. We've seen in the encrypted communication of Encrochat, SkyCC and Anom, how they in real time order murder, how they do the money laundering. So these drugs do not only kill innocent people that are using them, they are also killing other innocent people. We have an 11-year-old girl that was shot in Antwerp, a part of this drug trafficking. And when we see this new, it's not so new, but that the synthetic drugs are coming more and more. In 1 year, we destroyed 400 laboratories in the EU alone. So in the EU, we are not really importing, we are actually producing. And that is a new phenomenon that we need to tackle also more effectively when it comes to the police cooperation.
Thank you very much. Very important EU perspective. And indeed, 400 is a very large number, because if you have, dismantled 400, then probably there are many more that you haven't reached.
You've got to just add one quick point to that, because it's so important. Last year in the United States, the fentanyl that we seized, which is different than the fentanyl that's out there, what we actually seized, to your point, was enough to kill every single American.
Wow.
Oh, wow.
Wow. Yes. I think numbers say it all. Let me now turn to Ms. Machado to elaborate some more on the importance of multilateralism and countries working together.
Well, thank you once again for the opportunity to contribute to this discussion.
And sorry to interrupt, but also put this in the framework of the Brazil presidency of the G20 in 2024. And how can this presidency play a role in galvanizing international cooperation on synthetic drug threats? And how can the coalition also bolster this important role of such fora, such as the G20?
Well, Brazil's presidency on the G20 has been eagerly awaited, and we recognize the responsibility that comes with this position. Multilateralism is at the core of Brazil's concept of international relations, and the world drug problem is an area in which the need for coordinated action cannot be overstated. The principle of common and shared responsibility is the prime evidence of that. We consider that this global coalition on synthetic drug is a timely and important initiative to promote much needed exchange of knowledge, information, data and technology. It is an extremely valuable space for countries to learn from each other. We have much to learn in harm reduction strategies and toxicology expertise from other states, especially those who have dealt with this problem before us. On the other hand, Brazil has the opportunity to apply new approaches benefiting from the scale and nationwide structure of an universal public health system which is used by over 70% of the population. Taking drug policy conversations to different multilateral fora gives us the opportunity to go beyond criminal justice systems and punitive approaches, and to connect the fight against organized crime with human rights and sustainable development goals. The perspectives of Brazil and other developing countries have the potential to highlight the importance of addressing the impact of drug policies on the vast underrepresented groups living in the most vulnerable conditions. The fact that we are having this conversation right now, together with all the debates focused on the Sustainable Development Goal, is very meaningful. One of the challenges we can advance together is to build strategies that integrate public security and public health approaches that take into account global and tangled inequalities, and that also tackle private sector responsibility in cooperating and finding solutions. Thank you.
Thank you. Thank you very much. And now I will go to Sir Nick for a final question and ask you about the private sector again, the important responsibilities of the private sector, as well as the unique capacities of the private sector to have a positive impact. How do you think the private sector can contribute to addressing the synthetic drug threat? And where do you see the progress in this area?
Well, speaking for Meta, I'm not sure I can speak for the whole of the private sector, but when you're dealing with systems, platforms, which are all about content and information, you really want to do two basic things. You want to try and minimize the bad content that makes this problem worse and amplify the good content that seeks to address it. And so Meta has a bunch of rules, very clear rules, which sort of stipulate, certainly when it comes to illicit drugs or even regulated pharmaceuticals, what is and what is, more importantly, not allowed on our platform. And interestingly, AI systems, and I'm sure the same is the case for all the tech platforms, have become an incredibly effective and an increasingly effective tool at identifying that content at scale so that we can identify and remove it before anyone reports it to us. So I think now the rate at which, between January and June of this year, we removed several million pieces of content which violated those rules. And I think somewhere between 98 and 99% of that content was identified by those AI systems before any sort of human being reported it to us. So that's on the, now on the plus, if you can put it like that, on the plus side, if any young person, particularly, or anyone searches for information about opioids on Facebook or Instagram, they'll be redirected to the national helpline here in the US and other helpline resources. So that's the sort of two sides of that information ecosystem, if you can see what I like. It can never be perfect, but those are the sort of levers we try and pull. The only other thing I would add, because Secretary Blinken highlighted it as the third priority in the work for this coalition going forward, is the more that the industry and the tech sector in this instance can work together on shared definitions, shared standards, we'll just do so much better if we are all harnessed in a well-coordinated effort. And I can certainly speak for Meta, and I'm sure the other tech companies are the same. We very, very much want to lean into that, because what we've seen in other instances, when they, particularly because organised criminality, of course, they identify weak spots in the information ecosystem just as much as they do in any other ecosystem. So they'll go from one platform to the next, and the more that the tech sector can work together with the UN, with the US government through this coalition, the better.
Well, thank you very much. That's very good to hear, because we know that traffickers are abusing online platforms to market their wares, grow their consumer base, and play with perceptions. And it's very comforting to hear this commitment and to hear that AI is helping in tracking such criminal activities on these platforms. We come now to the end of this part of our meeting, of our discussion. And I would like to thank all the panelists. Thank you very much for the momentum, for the commitment to work together, to bring to global attention the shared problems, to help channel international cooperation and find shared solutions for what is really a global problem. And I would like to repeat what we have heard several times. It's not a matter of if, it's a matter of when. It is a global problem. We are working in 146 countries at UNODC, and we see this problem emerging in different parts of the world at a speed that is very, very alarming. We're committed to supporting multilateral action and international cooperation to stop synthetic drugs from taking and destroying lives in every part of the world. So thank you very much to all the panelists. And I would, before closing this, I would like to invite from the floor Ms. Alicia Bárcena, Minister of Foreign Affairs of Mexico, His Highness Prince Faisal bin Farhan Al Saud, Minister of Foreign Affairs of the Kingdom of Saudi Arabia, and Secretary Robert Oliphant, the Canadian parliamentarian, who will be joining us, and then will be followed by Assistant Secretary Robinson to conclude this event. So thank you for the panelists, and let's move to our seats and listen to them. Thank you very much, Secretary. Thank you.